Good day. Here's the latest news for today. With the amassed cases of COVID-19 in the province, PIATF head Dr. Jerry Kalingasan released an advisory for city and municipal health officers on educating people about ILI and how to treat them. Let's hear Mary Jane Salimbao for the report.
Yes, Queen. With the amassed number of COVID-19 cases in the province, the Provincial Health Office headed by Dr. Jerry Kalingasan released a medical health advisory addressed to all municipal and city health officers in the province effective last August 24, 2021. Under the advisory, Dr. Kalingasan made guidelines for public health physicians in their respective municipalities and cities, such as educating people that influenza-like illness like fever, cough, and cold is not normal nowadays because of the pandemic. Correspondingly, he directed the BHERTs, BHWs, BDRRs, MDRRs, Purok leaders, the BNS, the barangay health station staff, and the RHUs to be responsible in monitoring their constituents in their areas of responsibility.
And I told them also nga kinahanglan suyuron na gayud ang matagbalay sa BHERT, sa BHW or sa BNS aron ilang pangitaon ang adunay mga ILI.
Intensified surveillance on ILI must be done and must be treated immediately by the health workers in order to control the spread of the virus. Through this, the PIATF head is hopeful that these guidelines will be followed by the RHUs and the respective officers.
Now with this, I just hope and pray nga gabuhaton kini gayud sa atong RHUs. I've been following them up.
For 1 year and 6 months of battling against COVID-19, Governor Bambi Iman and Dr. Jerry Kalingasan, together with the frontliners and healthcare workers, is working tirelessly in order to help cope with the current pandemic and hopeful that through cooperation and coordination, the province will later on flatten its curve. This is Jane Salimbao, aimed towards a clean and honest governance, reporting for the province of Misamis Oriental. Queen? Thanks, Jane. In another story, both COVID and non-COVID hospitals in the province are now 60 to 75% full bed capacity. As per health advisory released by the Provincial IATF chief, COVID-19 patients are encouraged to take antibiotics to see if bacterial component is present and to immediately cure bacterial infections in the body. Here's Raymark Simanya for the update.
Queen Misamis Oriental Provincial IATF Chief Dr. Jerry Kalingasan recommends the use of antibiotics to COVID-19 patients in the province.
According to Dr. Kalingasan, that COVID-19 like pneumonia attacks the lungs. Preferably, antibiotics such as azithromycin may be given to patients to know if there is bacterial component and treat infections caused by bacteria in the body. In addition, the IATF chief gives instruction to the healthcare workers from Misamis Oriental Provincial Hospitals to provide antibiotics to people who exhibited influenza-like illnesses as treatment for 5 to 7 days. Respectively, Dr. Kalingasan underlined that MOPH referred to as COVID and non-COVID hospitals are now 60 to 75% full bed capacity. With such, COVID patients are requested to vacate non-COVID hospitals to cater non-COVID patients, such as expecting women. On a positive note, ivermectin, which had been under study for about 8 months, will have clinical trial on September here in the Philippines.
As all of our hospitals are full and infected patients have nowhere to go, the Provincial IATF Chief gives medical advisory as his responsibility in managing COVID-19 in the province, of which he clearly stated that the best idea and best decision still lies on the public. This is Raymark Simanya, aimed towards a clean and honest governance, reporting for the province of Misamis Oriental. Queen?
Thanks, Raymark. And that is the latest news for today. For more details, please visit the Misamis Oriental Provincial Information Facebook page. Once again, I am Queen Exclamador. Good day.